Hi, today I will be doing a urinary catheter insertion for a female patient. Um, the first thing we need to do is to make sure that I read the prescription that was ordered by our physician. Once I have the prescription, then I will go ahead and meet my client and explain the procedure to my patient. So let's start. Okay, we always have to maintain the privacy of the patient. So the first thing I would do is close the curtain. Good morning, Mrs. Jones. My name is Camila. I am here because the physician has ordered a catheter to drain your urine. Is that okay with you? Okay, great. How are you feeling today? Good, good. Do you have any allergies, Mrs. Jones, that we need to know? Any allergies with uh, any allergies that I need to know? Latex or anything else? No? Okay, great. When was the last time you voided? Great. Do you have any pain right now, Mrs. Jones? No? Okay, thank you. So I will be back. I will quickly go grab my supplies. At the meantime, would you like me to bring anything for you? No? Okay, perfect. Okay, Mrs. Jones, before we proceed, can I quickly get you to verify your full name and your date of birth? Great. Okay, thank you. Um, for my patient and myself, for to work more effectively, what I will do is quickly adjust my patient's bed, lower the railings, and also make the bed a little higher so I can work properly. Okay, perfect. So, Mrs. Jones, we will do a quick abdominal examination to make sure that you don't have any abdominal distension or to see if you have any abdominal pain. Okay? Okay, so I did a quick abdominal assessment. Now we can work on our sterile field. Um, I know I'm supposed to stay close to my sterile field. I just realized that this one, my catheter fell, so I just quickly grabbed it. But I know that I should not be leaving my field at all times. I made sure that my forceps was placed within the tip was placed within my sterile field, while the bottom did not have to be sterile. So unfortunately, you couldn't see it the way I placed it there, but it was placed the right way. Okay, so before I place my sterile gloves, I will make sure that my patient is placed in the position that she's supposed to be before we insert the catheter. The position that I will place my patient is dorsal recumbent. Okay, the patient is all prepared, and I will also pour my betadine into my cotton container. Now my gloves are sterile, so I can touch anything within my field. Okay, so my catheter is already prepared. I will use my sterile hand. I already have the lubricant on my catheter. So I will insert the catheter 5 to 7 centimeter. And then once I see the drainage, then I will proceed another 2.5 to 5 centimeters. Okay. So the catheter is well placed. If we need to collect a sample for another testing, we can do that right now. I will just reposition my camera. I know that I'm not supposed to touch anything with my sterile glove. Okay, I can see that the drain has stopped. So now I'll quickly remove the catheter. And at the meantime, I can check the urine that I have collected. What I will do is I will have to pour it in a graduated cylinder. And then we will need the measurement for charting for the patient. So right now I will quickly clean my patient. So, Mrs. Jones, how are you doing? Do you have any pain right now? Do you feel comfortable? Okay, perfect. So at the meantime, I will reposition my patient's bed as well. I make sure the railing is up, and also I will make sure that my patient is comfortable and lower the bed as well. So while I will do the cleaning, I will clean all my station. But what I wanted to mention is the urine that I've collected in the graduated cylinder. I will have to chart that, record it in patient's chart. I will have to check for the clarity of the urine, the color of the urine, the volume, how much my patient has voided, and also for any strong odors, and that's about it.